Hi, I'm Dr. Sridhar K. Welcome to my channel. We had discussed in the earlier video about what a suppository is and how to insert it. In this video, we will debate about whether use of the suppository is necessary and in what situations we should consider using it, and whether it is right to use it as a preferred choice for fever medications, as some families do. So obviously any form that is not oral is a little bit more invasive, so it's not the natural route, and so even though a suppository is more gentle than an injection, it's still invasive, and it's also offending the modesty, especially in an older child or in an adult, because we don't want anyone handling our private parts. Of course, if the child is unconscious or sleeping, it shouldn't matter. In the younger infants, we assume it doesn't matter, but we don't know. We know about the Freudian theories and the anal period of development, the anal Oedipal phase, and so on. So a lot of psychological development hinges on the anal complex. People have psychological issues related to handling of such areas. We don't know if it will have an impact. However, if the child needs it, it's okay to use it. Like, nobody likes an injection, but we still give it if it's needed. So the point is, you shouldn't consider using it as a primary mode unless there is a significant benefit. So where you can use an oral medicine for the fever, prefer the oral medicine. In UK, for example, very few suppositories are used. Hardly anyone prescribes suppositories because people don't like it. And once you don't know about it, you get used to giving the oral medicine. So having the parent say that my child doesn't take the oral medicine is more often a problem with the parent, because that's a way. Picky eating, you can refer to my video on picky eating as well. We create the problems, and same with discipline issues. So from the beginning, if we start encouraging the child to take oral medications, they usually take it well. I never had problems giving oral medications to my children when they were young. And similarly, I have not prescribed suppositories routinely for most of my patients unless they need them, and they don't demand it usually. But if they have been used to giving suppositories for fever, they often come with the remark, my child refuses oral medications and he vomits it when we give them. That's also a type of tantrum that they're trying to refuse, similar to picky eaters vomiting the food when they don't like it. So a suppository is definitely needed in situations where there is vomiting, when you can't give the oral medication. There are even suppositories for the medicine for vomiting, which is domperidone, which we used to have more routinely. It's not that readily available nowadays. Paracetamol or diclofenac, these are the two mainly used suppositories in the UAE. And if you refer to my video on fever management, I am against using diclofenac unless it's really necessary. So it's not licensed for the use of fever. Paracetamol is a much safer medicine, and ibuprofen is quite safe as well, while diclofenac is a much stronger NSAID. We should not use it for the routine use of fever unless it's an one-off use. So again, presence in a suppository form doesn't make diclofenac more safe to use. We should still consider using ibuprofen as a next line, or parallel treatment with paracetamol if the fever does not come down. So if the child is unconscious, we can consider using it. If the child is sleeping, we can consider using the suppository. If it's a very difficult situation and the child is not taking oral medication, it's possible to use it. Even in a suppository, the availability is not guaranteed, because if the child pushes it out before it's fully absorbed, you're in a dilemma whether to repeat it or not. We don't have that much of dose flexibility, so you only have certain strengths of suppositories which may not be the absolute weight-based doses that you need. So sometimes you may underdose or overdose when you use a suppository. So that is another disadvantage as well. So my suggestion is to keep suppository in the armamentarium. Don't use medicines you wouldn't use otherwise just because it's easier to use, like in the case of diclofenac for fever. Ibuprofen and paracetamol are preferable. Paracetamol suppository can be used in the situations I discussed, but don't get used to routinely giving paracetamol as a suppository. Prefer the oral medication either as drops or syrup where possible. Use a suppository only if it's very necessary. I hope this video is useful, and please do share. Thank you.